Jake never thought of himself as someone who would get addicted. He had a job, a girlfriend, a good family, just a normal life. Then one day, he hurts his back lifting something at work. The doctor gave him a short prescription to help with the pain. It worked. A few months later, stress at work started keeping him up at night. Another appointment, another prescription, just to help him sleep. When anxiety started creeping in during the day, there was something for that too. None of it felt dramatic. None of it felt reckless. It was all legal, all prescribed, all safe. Until one day Jake realized he wasn't taking medication to treat a condition anymore, he was taking it to feel normal. The US makes up 4% of the world's population, yet it accounts for over half the global pharmaceutical market. 60% of America is on at least one prescription drug, and 25% of Americans are on 3 or more. With such disproportionate numbers, it's a wonder as to why America has become the nation of medication. American healthcare is a fragmented system where pharmaceutical companies and insurers prioritize treatment over prevention. American culture views medication as convenient, fast, and effective solution to health problems, reinforced by a fast-paced lifestyle that demands rapid results, whether for mental or physical challenges. In its peak, the US saw over 250 million opioid prescriptions, fueling drug addiction and abuse. While prescriptions have slightly declined due to tighter regulations, Americans still consume far more opioids than any other country. In just 2021 alone, over 70,000 Americans died due to opioid overdose, many of which linked to prescriptions. So how did we get to this point? The pharmaceutical industry spends far more on lobbying than any other sector, spending $5.3 billion on politicians in the last 3 years alone. This is enough to get them favorable health policies and influence laws into their favor. In addition to that, the United States is one of 2 countries to allow direct-to-consumer marketing when it comes to pharmaceutical drugs. Since 1996, the advertising budget of pharmaceutical companies has gone up 10 times, going from $1.3 billion all the way up to $10 billion in 2024. This allows them to directly market their drugs to consumers whether they need them or not. 76% of people polled in a 2,000-person survey said that they have asked their doctor directly about drugs they've seen on television, with 23% of those saying they would change providers if the provider did not prescribe them the drug advertised. Insurance also plays a role. While many Americans have access to prescription drugs through private or public insurance coverage for non-pharma treatments such as therapy or preventative care is often limited. This creates a financial incentive to opt for medication over alternatives. Drug manufacturers make tens of billions of dollars every single year using these predatory tactics when they are quite shady themselves. Over 90% of American drugs are generic versions stemming from foreign manufacturers, the majority of which come from factories in India and China. Only 3% of factories in India are FDA approved. In other words, in 97% of these factories, the US government has no idea what the working conditions are. In 2022, an Indian Glenmark facility was issued a warning letter and had some of their products actually barred from entering the United States after the FDA went in and inspected some of the conditions that these pills were made in. Keep in mind, drug prices in the US are among the highest globally, but this does not deter consumption. The lack of price controls, unlike in other countries with nationalized healthcare, allows pharmaceutical companies to set exorbitant prices, which in turn fuels aggressive marketing to maximize profits. Americans spend $500 billion every single year on pharmaceutical drugs, and for uninsured or underinsured patients, drug prices can lead to financial hardship or even skipped doses, compromising medical adherence. The price of insulin in the United States is consistently 5 to 10 times higher than that of other countries. This is a life-saving medication that some families have to make great sacrifices to afford. It's estimated that 14% of insulin users have to spend over 40% of their yearly income on insulin, 40% of their income on medication they need to stay alive. This is a sad trap that millions of Americans find themselves in. The effect this has on the American consumer is substantial, as it makes many Americans dependent on these drugs. Consumers who regularly take opioids or other pills will undoubtedly build up a tolerance, requiring them to take even more pills just to experience the same effect. This goes hand in hand with the over 70,000 drug overdoses in the United States every single year. In addition, polypharmacy increases the risk of poor drug interactions between prescriptions, causing adverse side effects on the consumer. For example, a patient with diabetes and depression may be prescribed metformin, an antidepressant, and potentially benzos for anxiety, compounding their medication load. Side effects from medications like antidepressants or opioids can range from mild nausea to severe liver damage. Long-term use of certain drugs such as benzos can lead to cognitive decline or dependency. The CDC estimates that drug adverse events result in over 1 million emergency room visits annually. Health disparities increase over medication in certain groups. Low-income communities and minority populations often face higher rates of chronic illness and mental health challenges, leading to increased medication use. However, these groups may also have less access to holistic care. Now you may be asking yourself, why does this system exist? A lot of this can be contributed to the overprioritization of treatment instead of prevention. Chronic diseases equals reoccurring profit, and quick prescriptions equals efficient healthcare. Physicians in the United States face time constraints during patient visits, often leading to quick diagnoses and prescriptions rather than an in-depth lifestyle or preventative intervention. This creates blind trust between the doctor and the patient, because the patient does not know what these drugs do exactly, but they trust the credibility of the doctor to improve their health. Now, modern medicine is a wondrous and incredible invention that has saved the lives of billions. But this does not mean that major corporations have not taken advantage of the system. 68% or 92 of the 135 drugs included in this analysis of the top selling prescription drugs in 2020 were rated as offering low added benefit. Now, how can we curb this issue? It is going to take the effort of all Americans to be able to make a change, and the first step is education. Public education campaigns can promote a more balanced view of medication, emphasizing prevention and lifestyle changes, reducing the stigma around non-pharmacological mental health treatments, and could help encourage patients to explore therapy or mindful practices. Encouraging preventative care and non-pharmacological treatments, such as lifestyle interventions or therapy, could reduce the reliance on medication, and training physicians to prioritize holistic care and tightening regulations on off-label prescribing could also help. But doing this will not be easy, as it will directly cut into Big Pharma's pockets. But if you enjoyed or learned something new, make sure to like and subscribe. Thank you.